Forgotten World War II surgery secrets that actually saved lives. The battlefield wasn't just a place of bullets and explosions. It was a brutal classroom where life and death were measured in seconds. Yet, hidden in that chaos were surgical tricks and survival hacks that turned hopeless situations into life-saving miracles. These aren't the polished, sanitized lessons they teach in modern hospitals. No, these are raw, frontline secrets, tested in the fire of combat. And today, for the first time, we're peeling back the veil on techniques that saved lives when every second counted. How medics beat death in the mud. World War II medics didn't have luxury operating rooms. They worked in frozen trenches, bombed-out buildings, and muddy fields. Yet somehow they managed to pull soldiers back from the brink. One of the most remarkable secrets was how they handled hemorrhage, the #1 killer on the front lines. Tourniquets were basic, crude even, but when applied precisely, they stopped deadly blood loss fast. The trick? Medics learned exact placement points from years of battlefield experience, often improvising with belts, wires, or even leather straps when supplies ran dry. Timing was everything. Leave it on too long, and you risked permanent damage. Pull it off too early, and the soldier bled out. These split-second judgments weren't taught in classrooms. They were carved into memory under fire. Another technique that modern medicine has largely forgotten is the battlefield packing method. Medics used whatever they could grab: cotton, cloth, even grass, soaked in antiseptics like iodine or alcohol to pack wounds. They didn't just stuff wounds blindly. They layered the packing carefully to prevent infection and maintain blood flow, essentially creating a primitive but highly effective battlefield bandage that gave soldiers a fighting chance before they ever reached a hospital. The art of improvised anesthesia. Pain management was another area where frontline ingenuity shined. Morphine was rationed and hard to come by, so medics learned how to combine small doses with alcohol, cold compresses, and pressure points to dull the worst of the pain. They observed the body closely, noting how distraction and breathing techniques could make a soldier endure surgery with far less discomfort. It wasn't perfect, it was brutal, but it worked, and it saved lives. Speed over precision without compromising safety. You know, modern surgery values precision above all, but frontline surgery, by contrast, really valued speed. Seconds could mean life or death. Medics learned to operate under fire, sometimes literally dodging bullets while treating shrapnel or gunshot wounds. Yet, despite the speed, they maintained safety protocols that seem astonishing today. They knew the exact sequence: control bleeding first, remove debris second, then pack and stabilize. Each step was drilled into them, not through textbooks, but through necessity. One mistake could cost both the patient and the medic. Wounds that would kill today were often beaten then. Some injuries that would be fatal today were routinely treated by World War II medics. Deep abdominal wounds, for instance, were treated in ways that would make a modern surgeon nervous, using clever placement of cloth packing and saline rinses. They couldn't perform the complex surgeries we take for granted now, but they could stop infection, prevent shock, and keep soldiers alive until evacuation. Even cases of gangrene were sometimes beaten back using primitive antiseptics and vigilant monitoring. Medics became masters of buying time, knowing that survival wasn't always about perfect repair. It was about giving the body a fighting chance. Knowledge passed in whispers. Much of this knowledge wasn't officially recorded. It spread from medic to medic in whispered instructions in the middle of the night, shared as rumors in the trenches, tested and refined on actual patients. These were techniques developed out of sheer necessity, often improvised with what was at hand. For example, if antiseptics ran out, medics would sterilize bandages over fire or use local herbs known for antibacterial properties. Some of these herbs, once common battlefield remedies, are still effective today, but are almost entirely ignored in modern practice. So, mental fortitude and tactical calm. These were just as important as any surgical tool. Field surgery wasn't just about hands and scalpels. It was about mind control. Medics had to remain, unnervingly calm in chaos, because panic kills faster than bullets. Many survivors credited not just the medical techniques, but the medics' calm presence as the reason they lived. Quick thinking, decisiveness, and a steady hand were weaponized to keep soldiers alive long enough to reach proper care. The medics became not just healers, but psychological anchors in the storm of war. Lessons we can apply today. Even outside of battle, these lessons hold timeless value. Improvised care, layered wound management, and rapid, calm responses to trauma are all skills that can make a real difference in emergencies. Understanding how medics manipulated timing, antiseptics, and anesthesia gives us insight into resilience under extreme pressure. The battlefield was a harsh tutor, but its lessons are still potent. Whether you're a history enthusiast, a prepper, or someone just fascinated by the edge of human ingenuity. World War II field surgery wasn't glamorous. It wasn't comfortable, but it was effective. Medics made do with what they had, sometimes inventing new techniques on the spot. They beat death using knowledge, instinct, and courage. And while hospitals today offer technologies those medics could only dream of, the raw ingenuity of the frontline surgeon remains an inspiring blueprint for survival. If you've ever wondered how lives were snatched from the jaws of death, this is it. These secrets, these small miracles, are part of a hidden history that deserves to be remembered. So, if you want more stories that dig deeper than textbooks, more hidden lessons from the front lines of history, make sure to hit that subscribe button and share this with anyone who loves real, actionable, jaw-dropping World War II wisdom. The battlefield may be over, but the lessons aren't.